Welcome to Heart and Soul. Hi, I am Jimmy and I received a heart transplant in December 2019. And I hope you guys will help kiddos like me.
Welcome to Heart and Soul. We are so happy you're here today joining our virtual event.
This is Kaylin, and we come here to the Dallas Heart Center because of family history of heart illness, and donations like yours help keep families like mine coming to get exceptional care.
Welcome to Heart and Soul.
Thanks for joining us and helping out our kids.
We're so glad you came.
This is my daughter, Lorelai. We love coming to the Dallas Heart Center. It's convenience, it's right by home. We're great to come here and be able to get nice checkups, even for someone as young as her. We want to thank you guys for all your contributions. It's people like you is why we're able to come here and get the treatment she needs.
Welcome to Heart and Soul. Thank you for joining us.
It's because of your guys' donations and your generosity that makes our jobs here possible.
This is Malaya Price. She's been coming here since she was born. She's about to be 2 years old, and all your donations will help make her appointments possible. Thank you.
This is Milanka. She has hypoplastic right heart syndrome. Thank you for your generosity.
Welcome to Heart and Soul. It's your generosity that allows us to do the work that we do.
I am Ryan, and I first came to the Dallas Heart Center when I was 5 years old and diagnosed with pulmonary atresia and tetralogy of Fallot. Please make a difference.
Thank you so much for supporting the Dallas Heart Center.
Welcome to Heart and Soul!
This is Liam, who received a heart transplant on December 25th, 2015. Please give tonight.
Please give tonight. 9.
Welcome to Heart and Soul. It's generous donations like yours that make everything here possible.
This is Charlotte, and this is Garrett, and we're here to do follow-up care for Loeys-Dietz syndrome.
Your generosity tonight will help families like ours here at the Dallas Heart Center.
Please help kids like us.
Oh my goodness.
Well, good evening, and welcome to Heart and Soul Havana Nights. I'm Rennie Knott from 5 on Your Side, and it is my honor to be with you this evening. How about the dirty mugs, huh? Getting us started earlier. They are simply amazing. You got to give them a round of applause. And they will have much more for us coming up a bit later on, not to mention that opening video. Now, I'm not sure about you, but I am ready to do all I can to support Dallas Heart Center, a truly one-of-a-kind place inside of SSM Health Cardinal Glennon Children's Hospital. So obviously, the elephant in the room, and the way things have been for quite some time now. We're virtual, as I, of course, am with you, but I am not in the same room as you. Ironically, last year's Heart and Soul was the last in-person gala that was able to take place to support the kids of Cardinal Glennon. We have all adjusted day by day to the ever-changing world around us, and let me be the first to say thank you for still making the time to make a difference for our patients. If you are having any issues with your setup, please don't hesitate to call the number on your screen, 314-577-5605. Maybe even write that number down right now, just in case you run into some issues. Our program won't last long, but we certainly don't want you to miss out on anything, including your chance to give.
Did someone say give?
Oh, my goodness.
Hey, Rennie.
How are you?
Good to see you.
Good to be seen.
Everyone out there, you don't think there's going to be a Heart and Soul without your good buddy Tim Neiman, did you? I have loved being able to bring you auction items and fund and needs in the past years. And have loved being part of this event. And of course, I'm disappointed that I can't be there with you this evening. But I'm not disappointed with the opportunities you will have tonight to give support to the work being done at Dallas Heart Center. Throughout the night, I'm going to be dropping in and out on my new best friend, Rennie Knott, and telling you all about some of the amazing auction items. And also sharing some of the true impact that you can make with your dollars. So listen up. I want to make sure you hear this one. We are going to be showing you the current dollar amount raised tonight at the bottom of the screen. And you can help make that number grow by texting HEART21 to 76278. That's Heart21 to 76278. You will get a link to follow in response, and once you click, you can see the specific dollar amount you want to give. Now, normally, I would be there in the room with you and start at a dollar amount level and see who in the room would raise their paddle at that level. But we aren't able to do it this year. Instead, throughout the night, I'm going to be giving you an idea of the impact that varying amounts can make. So let me start at $5,000. A gift like that could provide a high-grade, portable echo machine. You know what that does? It allows a cardiologist the ability to be mobile and to take that machine to different clinics to see patients in rural communities, giving those children access to care they might not normally have had. If that dollar amount of $5,000 speaks to you, please give. Your gift can mean so much. Of course, we also have an auction this year. It opened a couple weeks ago, and it's been on fire. If you hadn't had a chance to check out the items and start bidding, again, you can just text Heart21 to 76278, or literally scan the QR code that is on your screen right now. Whoa. Wait, where'd I go? Oh, here I am. Also, we have some premier items that are just unbelievable this year. Judging by the bidding, you already know that. And I know you'll agree. Let me tell you about just a couple of them really quick. First up, spend a week in beautiful St. Martin in the Caribbean at a luxurious 3-bedroom, 4-bath villa on the cliffs. This is walking distance to nearby restaurants, shops, casino, and the beach. Bid now for that Caribbean vacation of your dreams. And 2 bedrooms, they have king-size beds, just so you know, and the third one has 2 queen beds. There's daily maid service. Check this out. You literally will not have to lift a finger. It's on mutually agreeable dates for 7 nights that expire 2 years from today, April 10th, 2023. And that is donated by Tim and Dana Batchick. Thank you two so much. Okay, check this out. Enjoy a down-home bayou feast prepared at your home for 20 guests. The chefs will prepare a char-grilled oyster appetizer, wow, and traditional boil of crawfish, shrimp, sausage, corn, potatoes. Included in the celebration is a case of Louisiana beer and 2 cases of Four Hands Heart and Soul special beer, which we all love. Crawfish season is limited, you know that, so if you're going to do it this year, it's going to be April 17th, May 8th, or May 28th, or on a mutual agreeable day during crawfish season, April through May next year, 2022. This is underwritten by Tricia and Don Boughton. Services are donated by Steve Vincent, and Heart and Soul beer is donated by the Four Hands Brewing Company. Thank you all so much. Finally, experience a St. Louis Blues home game like you never have before. Watch the Blues rule the ice from 4 lower-level seats. That's what you're doing the first period. The second period, you're in the broadcast booth with Joey Vitale and Chris Kerber. Access to the food and beverage in the exclusive broadcast suite, that's included for the third period, if desired. We are also throwing in a signed puck from our buddy and NHL Hall of Famer Chris Pronger. Once again, mutually agreeable dates, but this is for the 2021 and 2022 season. Thank you so much to the Blues, and a special thank you to broadcaster Joey Vitale. So what do you think, Rennie? You want to go on a trip to the Caribbean with me?
Well, you got to have a long talk with Mrs. Knott about that. If she says you and I can go, it's a boys' weekend. Yeah. Thank you, Tim. Let me let you think about that for a little while, though, because, I don't know, he's a fun guy, but I don't know if Mrs. Knott going to let me get away like that. Definitely going to need to be ready for this guy popping in all night long. Now, before we continue, we'd like to extend some special thank yous to our presenting sponsors this evening. Our co-chairs, Mimi and Greg Tordowski, and Kathy and Dave Tacklet. And thank you to all of you and all of our other sponsors. We couldn't pull off the special evening like this without you. We also want to thank our committee, made up of Dallas Heart Center staff, families, and volunteers for helping make this night an evening that will truly make a difference. Speaking of making a difference, those of you that purchased a party package are probably aware of a special delivery that came to you today. And inside of that delivery was a very tiny box. If you didn't receive one, I have what is in that box right here. And I wanted to take a moment to show you and talk to you about it. If you have it right now, go ahead and pull it out. It looks like this. If you have friends and family with you, please show them as well. What you're holding may be just slightly bigger than a walnut. It's a 3D printed model of an infant's heart. A 1-month-old infant, this patient was born with a complex congenital heart. This heart had a large hole between the bottom 2 chambers, and without the skilled work of those in the Dallas Heart Center, this child might not have had the outcome that it so desired. I wanted you all to see this and just try to get a glimpse of the sheer size of this. Now, by comparison, I want to show you something else. This is an adult heart. So how do you operate on a heart this small? Can you even imagine how many exams and counselings with the family this child was able to go through to have a successful procedure in the hybrid lab with both a heart surgeon and a cardiologist working in a perfect collaboration? Hey, Tim, can you believe this?
Wow. I'm looking at it. My mind is blown by just seeing and appreciating the skilled hands that fix that little bitty heart. You know, I know earlier I mentioned to give a gift of $5,000. How about a gift of $1,000? What could that cover? You know, that could cover the cost of a stent that was used to fix this little bitty heart. That stent was being placed in a blood vessel, keep it open, which was required for that infant child to live. Wait a minute. Who would ever text me right now, of all times? Hold on a sec. I got a text. Oh, man. It's from our good friends, Bridget and Tom McMillan. Wait a minute. They're going to match the next $10,000. Wow. Thank you so much for that generosity. Let's make that match matter, and let's give now.
Wow, that is tremendous. Thank you, Tim. Definitely makes it real and impactful. Now, I'd like to take a moment to recognize a very special group that has been instrumental in this year's Heart and Soul event, the Glennon Guild. For more than 60 years, the Glennon Guild Women's Auxiliary Group has been instrumental in the success of Cardinal Glennon, from hosting their own events to partnering with the Cardinal Glennon Children's Foundation. We are so thankful for their experience and dedication to our patients. For the first time this year, the Guild has joined forces with the Heart and Soul Committee to present tonight's virtual experience to all of us. And now we have a very special message from Glennon Guild member Beth Pelch.
Good evening, everyone. I am Beth Pelch. I am co-chair of tonight's auction, and I am a member of the Glennon Guild. On behalf of the Glennon Guild, I wanted to say thank you to each and every one of you for joining us tonight. The Glennon Guild is honored and excited to help plan and present tonight's Heart and Soul virtual event. I want to tell you a little bit about the Guild while I'm here. The Guild was started in 1957. It currently has about 100 amazing and talented women, and our mission is to support the children and patients at Cardinal Glennon Children's Hospital. We do this through fundraising, volunteering, and anything we can do to lift up those patients and support those patients. We bring different skills and experiences together, and we honor that mission every day. I want to give a special shout out to some of my fellow Guild members, Linda Kamlos, who is my co-chair for the auction, Bridget McMillan, who is our Guild president and dedicated to helping these children, and Mimi Twardowski, who is an event chair for tonight and also a major sponsor. And finally, all the very amazing and dedicated women who have helped make the auction possible tonight by donating their time and their services and their incredible resources and contacts to give some amazing items for the auction tonight. I hope you enjoyed tonight's event. And if you are able, please pick up your phone right now, go to the auction website, bid on some amazing packages, And while you're there, please make a donation if you can. Any amount is great. We love any amount, and we hope you can give to make a difference. We've made it as easy as possible. Please enjoy the evening tonight. Thank you.
Thank you, Beth. And thank you, Glennon Guild. Your support is unwavering, and we are very, very grateful. I wanted to share with all of you just a glimpse of what happens in the Heart Center each and every day. On average, the Heart Center has over 5,000 visits of patients each year. They also do an amazing amount of outpatient procedures annually. I'm talking about 17,000 of them. Now, here are some other key stats that you should know. More than 1,000 procedures in the region's first pediatric hybrid catheterization suite. 400 heart surgeries. Listen to me. That's 400 times skilled hands made the difference in the life of a sick kid. And get this, they have performed more than 70 pediatric heart transplants since the late 1980s. And of course, the Dallas Heart Center team has been ranked as a center of excellence by U.S. News & World Report for 8 consecutive years. In fact, they were the first team to be ranked at Cardinal Glennon.
And you know what, Rennie?
Oh,
that doesn't happen without support from people just like everyone that's watching us right now. And we want to keep that support rolling. We've talked all about the different dollar amounts tonight. So let's talk about $500. A gift like that could provide an infant pulse oximeter. Now, those are big words, and I know that. But that device, what it does is crucial. It could help diagnose congenital heart disease due to low levels of oxygen in an infant's blood before it becomes critical. I see our dollars raised continue to climb, so let's keep it going. To give, text the word HEART21 to 76278. That's HEART21 to 76278. And follow the instructions. We need your help. The auction is still going strong. You all have always been huge supporters of the online auction. But if you haven't had a chance to check it out yet, don't miss your chance to bid on some exclusive experiences that only are available tonight. So there's a couple more that kind of stood out to me. 7-night stay at Lake of the Ozarks in your very own Southwood Shores lakefront condo. Host your own outdoor beer BQ party for 30 people, donated by Sugar Fire Smokehouse and Four Hands Brewing Company. One final one, real quick. Enjoy a 4-course dinner for 10 in the comfort of your own home, prepared by local chef Karen Page. So many other great items to bid on, including photography packages, stylish accessories, exercise classes, sports memorabilia, and more. Bid now, bid often. Rennie, back to you.
All right. Thank you, Tim. Those are some amazing items and some incredible experiences. So we are so thankful for all of you who donated these items. Now, this past year was difficult for so many people and businesses, but as you can tell, the spirit of generosity lives on in St. Louis. Make sure you check out the auction site to learn more about the items Tim mentioned, as well as all of the other items that are available. Just text the word HEART21 to 76278 to see it all and support the kids served in the Dallas Heart Center. All of you out there, you may or may not have been impacted by a heart defect, but I know I have. It's different for me, though, because, of course, I wasn't born with my situation, but I will never, ever forget when they told me that my heart was failing. I thought right then and there that that was it. I was going to die. But I'm so thankful that that was not the case. What I had was a major surgery out in San Diego, California. It's called a PTE surgery, lasted for 9 hours. What the surgeons did was remove blood clots from my lungs. You see, prior to that, my heart was failing. It was enlarging because it couldn't push the blood into my lungs. My kidneys were failing. My legs were swelling. Everything was out of whack for about 3 years. But now, I'm so thankful to be here with you. But for almost all of the patients that are treated at the Dallas Heart Center, this has been a part of their journey, sometimes even before birth. And that is what I want to share with you now, that the Dallas Heart Center, along with the St. Louis Fetal Care Institute at Cardinal Glennon, are making a difference even before a baby is brought into this world. Please watch this video.
Dr. Lehman and I both work at the Fetal Care Institute here at Cardinal Glennon Children's Hospital. So we work with a team of maternal fetal doctors and get a lot of referrals from our OBs in the community.
Most families come to us at least prenatally after getting their 20-week anatomy scan. So if the OB will see something abnormal or have suspicion for something, they'll refer them to see us. Congenital heart defects are probably the most common birth defect that someone can have. In the United States, 40,000 babies are born with a congenital heart defect in a year.
Currently, there's not one single cause that causes congenital heart disease. There likely is some genetic predisposition, but then a lot of environmental factors as well.
They tell me what I was having. I was happy because that's what I wanted. I wanted a girl. They just kept having different people coming in the room. Doctor looked and he was like, okay, something's wrong with her heart. It looked like it's not developed correctly. And so I started crying immediately. You know, I finally get what I want and then something is wrong with my baby, you know.
Dr. Holcomb was on video and he said, you know, everything looks great. His size is good, his head's good, everything looks, you know, good except his heart. He said, I think he's got something, I can't confirm it, but I think he's got something called Epstein's anomaly. Cardinal Glennon called us that day and they said, you know, we're gonna get you in on Monday. Dr. Lehman has an opening.
When the family first meets us, and if they come to me first in terms of having a fetal echocardiogram, I'll be in the room with the mom, with the family, and be able to see live exactly what's going on. And then afterwards, be able to sit down with them in a separate consult room and actually give them the diagnosis. And not just the diagnosis, but really what that means.
We got our first echo, and they confirmed that it was Epstein's anomaly. Dr. Lehman sat there and showed us pictures and said, I remember she's like, I'm just going to tell you the rates for an Epstein anomaly. Doesn't mean this is the case for him, but that the living rate is 60%. It was just, that was really hard because I cried. I kept thinking, good gracious, you know, you're expecting that you have normal baby and it just got confirmed that he could potentially die.
You're delivering, you know, pretty devastating news. You know, their pregnancy is going to not be like their friends and their relatives. You know, from more frequent doctor visits to just the uncertainty and the anxiety regarding the future of their baby.
Dr. Reddy let me know that this is going to be a long road that we have to go through, but I'm going to be here with you to help you through it.
I didn't get to hold him very long. And they took him, and then they wheeled me up to the postpartum floor. That was hard, because I kept thinking, because he wasn't going to come back to me.
She was in the surgery for like 9.5 hours. Dr. Huddleston came out, and I didn't hear anything, but I just wanted to hear, your baby is fine. That's all I wanted to hear. That's all I wanted to hear. Your baby is fine.
They always try to prepare you for what you're going to see. When you go in after they've had surgery, nothing can ever prepare you for that. He was swollen. He was on a ventilator, which we understood that was going to be the case. I just remember crying.
The machines started to come off and more of the medicine started to come off, and I was just praying. I was praying the whole entire time that, you know, God fixed whatever the problem was.
We're very fortunate at Cardinal Glennon that we have, you know, the latest technology to be able to identify all of these congenital heart defects in these babies and the complexity. We have top-of-the-line ultrasound machine for fetal, but we also have a cardiac MRI scanner. We have a 3D printer. So all the tools that we would need to, you know, diagnose these babies' hearts and understand sort of the complexity and the fine detail is present. Having the supportive resources to kind of uniquely treat this population of patients, whether it's supporting them with having the best technology, having the best operating room machines, having the best ultrasound machines, like every aspect of a diagnostic tool or a technology that goes into either helping us diagnose our congenital heart disease quicker, faster, better, to improve outcomes so that these kids you know, can live longer and live better lives, I think is critical. And so definitely having the funds to support purchasing all this equipment and supporting our support structure or our clinic structure to be able to take care of these kids is hugely important.
I always ask myself, is it better to have found out early or to find out after he was born? Because it kind of dampens your pregnancy because you know he's sick. One of the hardest things is hearing, that he could potentially die. Dr. Lehman was like, nope, that is not what's going to happen here. I believe everything with as well as he's doing, that's not going to be a problem.
Constantly went to see Dr. Reddy. Dr. Reddy was telling me every day she was getting better. And I put my trust in her. And like I said, we're very cool. I love her. That's my girl. And she loves Erin. She'll come from all the way upstairs when we got a doctor's appointment. If we're not coming in there to see her, she'll come all the way downstairs to come find Erin because she knows, where's my girl? Boom. There she goes. She comes see your girl.
We do follow our own fetal patients throughout their pregnancy and even while they're in the hospital as well. And so I think getting that specialized care of that one person that is your person, basically, who's going to help, right the ship or direct the ship. But yet we also work very closely with our colleagues, and that team approach of knowing kind of what your wishes are and kind of together approaching the family is really important.
The most fulfilling portion of that too is being able to be with the family and be with them, not only giving that bad news, but being able to be present and help them and guide them through this process. I think being able to see our kids grow from babies to infants to toddlers to teenagers, I think that's why we do it.
Wow. I mean, wow. What a difference made. Because of the commitment of our specialized care teams, because of their devotion to each and every patient, because of you. Your support makes it possible. Don't let this opportunity pass for you to make a difference. Would a gift of $250 be possible? That size of a gift can provide a month's supply of formula for a baby who requires extra nutrients to thrive. It can supply 2 cases of NG tubes that are used for feeding directly to the stomach through the nose of a child, something that is so important in the care of a sick patient. So many of you have already given this evening, and it has been my honor to watch the amount of money raised for the kids of Cardinal Glennon continue to climb. But I leave you with this. It's been over a year since our worlds were changed by COVID-19, but our worlds pale in comparison to those of the families also dealing with such overwhelming situations and battling congenital heart disease. And that's the thing. These battles couldn't stop just because COVID happened. And that is why we can't stop doing what we can to make the world a better place for these patients. Again, a better place for these patients. Your support moves mountains. From providing state-of-the-art technology that can help diagnose heart defects in fetuses at 18 weeks to facilitating the ongoing care for our patients into their adult years to 8 consecutive years ranked in the top 50 pediatric heart centers across America. All of this was made possible by the generous support of people just like you. But let's show the kids that we aren't done just yet. I have talked about many different levels of dollars this evening, but just so you know, all gifts in all sizes, even $100, can literally change the world for a child. $100 can change the world for a child. So if you can, please do, please give, and please do that tonight. I also have another quick reminder. You can still support the online auction until 9 o'clock tonight, and of course, every gift, any amount, makes a difference for the kids in the Dallas Heart Center at Cardinal Glennon. I'm going to tell you guys something. It has been my pleasure. Let me correct myself. It has been my privilege to be with you this evening.